Good morning to our Fairfield community. Thank you again for being here. First off, I want to thank Ames Companies, or what we formerly known as Harbor Brush, has been a great partner for many, many years. Yesterday, I received a check for $3,000 to go towards materials, which will then be made into hospital gowns for our medical staff. We really, really appreciate this large donation. Sorry. Again, thank you to Don Sanders and April Gentry for making that happen within their company. I'm going to turn it over right away now to Chris and get an update from her.
Thank you, Connie. Good morning, everyone. I'm Chris Estle. I'm the Public Health Administrator for Jefferson County. I just want to thank everybody for their generous donations for masks for frontline staff. I'm happy to report that our hospital, public health, nursing homes, assisted living, senior living complexes such as Logan, Wagon Wheel, and Kaloo have all received masks. We are trying to wrap that up with frontline providers right now, and then we will reach out to other community partners that may be in need of a cloth mask. So thank you to everyone that's donated to that. Again, with what Connie just mentioned with the isolation gowns, we are working diligently with that. We have several gowns that have been assembled and brought back to the health department. We're just kind of being the drop-off and pickup center. What we hope to do when we get more fabric that is cut and ready to assemble is you can call the office. We will have it in a bag, and we will just like have it outside the door for you to pick up, so there's no contact of any human form, so we don't have to worry about contamination that way or sharing of any kind of illness. I want to touch base right quick. We've had a lot of calls at the health department about food and meals and the delivery thereof. I just want to reiterate some things that go on in Jefferson County. So we have Meals on Wheels, and that's going to be in today's press release. I know that they have changed their delivery system. They're no longer offering hot meals daily delivered. They're offering frozen meals. You can get 1 to 5 frozen meals per week for a one-time delivery. So that contact information will be in today's press release. The school lunch, we still have a program with that. That information is for our Jefferson County folks as well. Come to Supper is offered and provided by the Lutheran Church here in Fairfield. It's Briggs Street is the address. It's right across the street from the health department or the fire department. You can contact the Lutheran Church for that, and if you want to make a donation to that, you can. And of course, our Lord's Cupboard is the only food bank per se that has brick and mortar in our county, and I do have that number written down. It's 472-8457. Again, that's the Lord's Cupboard. And I know that Laura Cohen and her volunteers are working diligently to get food out to the individuals that need it. So just a quick rundown of some things that are going on in the community as far as public health. We continue to listen to the governor's press conferences on a daily basis, and I know that there's been some new information for testing. I'm going to let Dr. Trent speak to that when it's his turn to go. I don't want to steal his thunder on that. We continue to offer weekly webinars with our community partners, Zoom meetings, whatever you want to call it, Zoom meeting, I guess. We're going to be looking at maybe changing that a little bit. Those are the frontline staff so we include nursing homes, assisted living, hospital partners, law enforcement, fire. So we've been meeting weekly for quite some time. We're going to see if we need to change that a little bit. Right now, we're kind of in a holding pattern. We're still at 7 lab confirmed cases in Jefferson County. Again, I can't stress that enough, that it's just a point in time. A lab test is just a point in time snapshot. I understand people are getting frustrated. It's, this seems to be going on forever. I hate to be the one to break it to you, but it's going to go on a little bit longer or a lot longer. We just don't know for sure. So we need for everyone to be patient and understanding and work together and be respectful. Try to do what you can to get outside, get some fresh air, maintain social distancing. Again, we've had a lot of changes. We'll have a lot more changes. With last week, I got a little emotional talking about Mother's Day, school graduation, and then the next day the governor said, school is done for the year, which I totally support that decision, and that's the best decision that could have been made for the safety of those individuals. I know locally we're going to have changes to activities that we all depend on going to annually, so just be supportive of those individuals that are on volunteer boards or serve your community in a different capacity. Those are difficult decisions that are going to need to be made, and I would ask that you be supportive of those individuals making those decisions for the greater good, and that is your health and safety. We continue to have our Emergency Operations Center open. Brett comes up daily. Dr. Trent comes up frequently. I want to give a shout out to the health department staff. They keep it all going behind the scenes, and I can't thank them enough. And again, all of our other community partners and elected officials, I just want to say thank you for your continued support. And if you guys have any questions, enter them in, or I'll come back at the end. But I'm going to turn it over to Brett, our emergency management coordinator. So thank you.
Start off with just like to say, Jefferson County Emergency Management continues to work at a local level closely with public health, JCHC, all of our first responders, law enforcement, long-term care facilities, county attorney, Dr. Trent, and our elected officials, and we greatly appreciate the communication that we have with them on a daily basis during this COVID-19 pandemic. I also work closely with Homeland Security Emergency Management Division at the state level with daily briefings and updates. I get all my information from the state web EOC from there. So as Chris said, our EOC is still open. We are currently at day 40 of an active EOC, Emergency Operations Center, which is jointly with Public Health. And we're involved with numerous virtual meetings and briefings with local partners and emergency management partners in our district and in the state. It's always been our priority to get the most up-to-date information, factual information, so we can share it with our community and also prioritize the information to make tactical decisions on our current response and future responses to the pandemic. Number one, keeping our frontline workers safe. The nurses, the law enforcement, the first responder, people are dealing face-to-face every day is a top priority. And with that priority, the PPE situation is something that goes through me, and I take great pride in making sure we get the right PPE to our community. Yesterday, we received another delivery from our state stockpile, which was delivered to JCHC, and then it was inventoried and is made available to our healthcare workers and our care facilities and our first responders. And I appreciate all the work that those individuals do at all of those places. They are the heroes of this. The frontline people are the heroes on a daily basis during this pandemic. So again, like I've said, we are fortunate to live in a community that's so passionate, where everyone steps up to try to help. And as emergency management coordinator, I greatly appreciate all of that. We can't do everything ourselves, and we live in a great community. And we have great communication with our elected officials and our leaders of this community to make our jobs easier as we move through this. So keep practicing social distancing and follow our current guidelines that are in place, and we will get through this and move closer to getting back to what we are used to.
Hello, I'm Bryan, the CEO of Jefferson County Health Center. As far as an update for the hospital, we continue to have all the same safety measures in place that we've had in the past. We continue to monitor all the new guidelines and updates that are being provided, and we adapt as they come out. All the restrictions, again, that have been announced previously are still in force, so we're still under no visitor restrictions right now and other safety measures. As far as the testing that we've been reporting in the past, we do have on our website that is listed 120 tests have been collected. There have been 6 positives, 107 negatives, and 7 pending as of yesterday. Those are any patients that come from any county, not just Jefferson County. So our hospital does serve other residents from other counties, and so they would be included in these numbers. Since our last update of last week, JCHC had 2 confirmed cases admitted to the hospital. Our staff did a great job of following our safety protocols that were in place and did a great job in providing the care for the patients and what they needed. The patients were isolated away from the rest of the admitted patients, and those caring for the patients wore the appropriate PPE. At this point, both patients have been discharged from the hospital. I share that with you today as a one-time information sharing, and we will not be reporting that information in the future. But I do want the community to be aware that the hospital has been preparing for that to happen for several weeks. We handled it, we took care of the patients, and were able to provide the care that they needed. And we are ready to continue to provide the care for any patients that are in our community and are seeking care. We will continue to individually assess the patient and determine whether we can provide the care here for them locally or whether they need to be transferred to another facility. And I can't say how proud I am of our staff for the job that they did and for the care that they provided. Again, on top of the normal workload that is being normal care that is being provided for our patients. They did a fabulous job. As far as the as state update this week, Governor Reynolds has mentioned or announced the Test Iowa initiative. I think it's already been mentioned, Dr. Trent's going to touch on that. I'm not getting into a lot of it, but we have gotten questions already from community about it, on how the hospital is related to this. And what I can share with you is that the hospital found out on Tuesday when it was announced, like everyone else. We are not connected with the Iowa Test Initiative. It's not that we don't support it, but the locations are not at hospitals. So if you go on the website and you qualify or recommended to have a test, that test cannot be done at our hospital. It has to be done at a testing location that is being set up by the state. Those results also will not come back to us as the hospital or the provider. Those results will go to the individual who had the test taken. And if you choose to share it with us, then that's how we would get the information. At the end, or to conclude, we'll continue to follow all the guidelines that are being recommended. We'll continue to monitor the situation and provide all the safety measures that we can for our patients and our staff. We'll continue to make sure that we're able to provide the care that we can here locally and continue to keep people safe. Thanks.
Good morning, afternoon. I'm James Trent. I'm the Medical Director for Public Health for Jefferson County. First of all, I hope you can appreciate, again, the amount of coordination and cooperation that has to go on between public health as well as emergency management, public safety, the hospital, businesses within the community, and everything else that goes on within our community to help keep our community safe and healthy. It's a huge effort for us to be done, and there's a lot of work that goes behind the scenes. We get up here every week to talk about this, are only a few that are involved, and there are many other people that are supporting and making this actually happen. And we're very thankful for the effort that's been put out by everybody that's getting involved with this, by different organizations, but also as you as the general public. And we're thankful for those that are trying to socially distance as well as limit shopping, and also mask up when you're outside, and try to help others in the community that are in need. Sometimes it feels like this is in slow motion, and it really kind of is. It would be different, I think, if we were having something like akin to New York City, but obviously we're not in that sort of serious situation. But the idea that being prepared is very important, that we're all able to prepare for this particular pandemic, if and hopefully when it comes. So the people sometimes will wonder, well, when is it going to hit? When is it going to hit? And the real answer, and we've said this before, is we don't really know for sure. The models initially had, depending on who you looked at, had looking at late April, like to be where the surge would happen. Now that puts out until May. Whether or not that really happens or not, it is really unknown. But the thing to keep in mind is all models have different assumptions, and they're not just one model out there. There's several that you can look at, and all the assumptions are different. All the assumptions in terms of social distancing and other public health initiatives, and also how it spreads. And so people will wonder, why can't we nail this thing down? And part of that is because models are, imperfect intrinsically, but they kind of give us an idea how things might work. But again, you'll see from model to model things that are very different depending on who you look at. So we will continue to monitor and look for information that would suggest that there may be a surge in cases. Fortunately, we have been at a situation as a county that we don't have to worry at this point about being in surge-type conditions, but it certainly could happen. So being prepared is the utmost importance, and it does take some time to get ready or to be patient, actually. And it's kind of like in the military, they used to tell us to hurry up and wait. And that's a true principle, that we have to kind of wait, but we have to be prepared, because if we're not being prepared, then we're certainly asking for trouble. As has been mentioned by Chris and Bryan, the Iowa Governor Kim Reynolds has mentioned this new testing initiative, which takes after a testing initiative that was done in Utah. This is the Test Iowa initiative, which is partnering with several different private companies in Utah about getting tests done and also be able to analyze the data that comes from that. Their initial crowd of targeted audience is those that are frontline providers, EMS, healthcare providers, et cetera, to provide testing to those individuals, and then further on to symptomatic individuals. And as it spreads out and more people are able to get tests completed, to maybe even asymptomatic individuals. This helps us understand the spread of the virus, also helps us understand hot spots that might be developing within the state. And so this is, again, at no cost to be tested, which is a great thing. So if you go on to testiowa.com, that website will direct you through a series of questions, and it will ask you your name and address and email. It will also ask you the type of work that you do, and your age, and your any underlying conditions that you may have. And so it will try to get a good idea in terms of if you are an individual that might need to be tested. It will also ask you about if you have any symptoms of any sort, if you what kind of work that you do, and so if you've come in contact with anybody that had COVID, or if you've traveled to anywhere that has had COVID-19. Now, once that has all been done, then the website will tell you, yes, for instance, you're able to be tested. I actually logged on to it while the governor was talking about it a couple days ago, and it told me, yes, I can be tested. That's just part and parcel of what I do for a living because I'm a healthcare provider. My daughter, who lives in Utah, and Utah's been doing this for about 2 weeks now, she's a nursing student over at BYU, and so I told her to get on the Test Utah website, and she didn't even know about it, but she got on and told me that she's being tested today, actually. So as time moves on and more people are involved, initial testing will be in Des Moines this Saturday, but as they have more people they're testing and they see kind of the geography of where maybe hotspots are or where they might need to focus more testing, they intend to open more testing sites and more dates for that. So I myself, I wasn't planning to drive up to Des Moines this Saturday, so I'm going to wait and see what happens, what other testing sites develop, as I suspect there'll probably be ones that are closer by here. But we are encouraging everybody to get on that to see, and also I know they've said that if people could be tested potentially multiple times. As I understand it, they have capacity for over 500,000 tests to be done. And that's aiming for about up to 3,000 tests per day over a period of so many days. And so the testing that can be done could be multiple times depending on person. As we've mentioned before, a test is a snapshot in time, as Chris Estle's alluded to, yet it doesn't mean that you wouldn't potentially become symptomatic or have contact down the road with somebody who had COVID-19. So you might have that. And so, as Bryan also alluded to, the information comes to you by email, and as far as you would having to alert public health entities or what they would do with that information isn't completely clear to me right now. None of us really knew about this initiative, but we support it, and hopefully, as you participate in it, this will become a great way for us to understand how the virus is working in the state and what other measures that we need to complete. So please get on testiowa.com and fill that out. And we appreciate your patience. I know this is difficult to do. Continue limiting your outings to the public if you can for shopping, or if you can help others that need help shopping that might be at risk, elderly, those that have underlying health conditions. And we appreciate the efforts that you make, because they do make a huge difference in how this epidemic is treated. Thank you.
Hi, I'm Darren Hamilton, Jefferson County Supervisor. I would like to say thank you to Chris Estle and to Brett Ferrel, Dr. Trent, and Bryan Hunger, also Mayor Boyer, for all their involvement of what's going on with this disease and how we can track it and help slow it down in our community. The only real things that I have to speak about today is that the county has started their paving projects. The project over on W40 going north from Lockridge to Four Corners is having asphalt laid on it today. Early next week, you'll start seeing some work on the Pleasant Plain Road just south of Pleasant Plain, so it's going to slow down traffic. You'll have to watch for construction zones. There will be pilot cars involved in this. Once that's completed, they're going to want to start skipping around the county, laying down a special type of asphalt surface, which is underneath our primary surface above, that has a special mixture to it. This will allow the roadway to last longer because of it. So please remember that if you're out traveling around the county, there's not only the construction zones to worry about, but the farmers are now back in the fields pretty good and strong, and we need to support them as well. So thank you very much.
Thank you again for joining us today. I don't think we had any questions. So I think the main new thing is this Test Iowa, where people can go and do the assessment and then determine if you need to be tested. For next week, we are going to try to bring in some additional people in our community, some of our larger employers. We can get some updates from them. Primarily at this point, it's been our public partners and focused on healthcare. But there have been questions in private business, education, those kinds of areas, so.
Do you want me to talk about follow-up? That was a question I didn't talk about.
Yeah, that's right. So next week, we're going to try to have some new people here with some new information, but before we go, we did have a question on people that, what the county health, the public health does when somebody is tested positive and the follow-up that they conduct, so.
Okay, it won't take but a second, excuse me, Connie. So I just wanted to say right quick, local public health departments are responsible for communicable disease follow-ups for all communicable diseases, with the exception of sexually transmitted diseases or infections. Those are performed by the state health department. So what happens is the local health department is notified by the state health department of a positive case that is in a highly secured system called IDES, which stands for the Iowa Disease Surveillance System. We then are given the patient information, name, date of birth, address, lab results. If it's appropriate for the illness, then what they have been started on for medication, et cetera. So then what we do oftentimes is we'll see who the provider is that ordered the test. Then we make contact with the provider to make sure that they have contacted the patient, or to make sure that the patient is, like I said, on the correct medication if that's appropriate with this COVID-19. That's not an option right now. And then we do what we call, close contacts or household contacts or work contacts, depending on what the illness is. So we start with that patient, their close contacts at home, and then it's the ripple effect. We take it out so many rings of contact depending on what the communicable disease follow-up is. And with this, we're following people for 14 days, and then we check in with them, we talk to them, we see how they're doing, we give them the phone number if they're having any problems, or obviously if they're having any life-threatening problems, they need to act accordingly and call 911. If they just need to get in and see their provider, they can call first, make an appointment. But that is how local health departments have been dealing with communicable disease follow-ups for many, many years. So I just wanted to say, yes, if you get a call from your local health department, that is normal, routine procedure for a communicable disease follow-up. And then we'll just, I'll dial somebody up and say, hey, hi, this is Chris Estle. I'm calling from Jefferson County Public Health. We've been in contact with your provider. This is what's going on. And that's why we always make sure that we call the provider first, to make sure that that patient has been indeed notified of whatever illness, because nobody wants to get a surprise phone call from somebody that they didn't even know had access to their information. And it is all highly secured, confidential information protected by HIPAA. So again, that's normal routine procedures for follow-up. So does that answer that, Connie, or does somebody have? Okay.
You want to just also,
Excuse me.
I'll just ask one more question, and that is a question that I also got through an email, and that is how you interact with other counties' public healths, and how you help when needed.
Sure. Right now, we are helping our partners in Louisa County. Roxanne Smith is the public health administrator in Louisa County. It's a little unique there because they don't have a hospital in their county. So they have Columbus Junction, which has the meat processing plant, and we all know what's going on there. So several weeks ago, the state authorized, we said we could help as local public health. So the state authorized so many of her cases be transferred to our database in the disease surveillance system, so we could start follow-ups for Roxanne and help her department. And that's routine if a local health department is inundated and can't manage those numbers. I do know that our state partners are using, the National Guard and other people that work within the Department of Public Health, that this might not be their routine job, but they already have access to a clearance to information. So I know they're pulling in other people that maybe aren't used to doing disease follow-up, but you can ask the questions, you can get the information. Especially right now, we're seeing, the need for other languages and interpreters to be used, and that's a barrier too. I speak English, and I am not very fluent with any other language. So we have to take into account, cultural differences and language barriers. So it takes a little extra time when we're doing those communicable disease follow-ups. So does that answer that question? Okay. All right. Yep.
Okay. So with no additional questions, we'll close for today. We will see you next week, and again, we will try to have some partners, some community partners with us in addition. So we'll see you next week. Thank you.